Hi guys, good evening. This is Dr. Jenny Yusuf, physical therapist and doctor of physical therapy, creator and founder of Balance and Fall Support Group in aging adults and Physiogen PT and Wellness. So thanks God it's Thursday. It's another day to feature and highlights entrepreneurs, physical therapists, academicians, and tonight we have the opportunity to highlight and feature another physical therapist who's really making global contribution to our other physical therapists. He is the founder and creator and host of PTMEAL podcast. So we will learn more about how it goes, what's his motivation, why PT Meal, it's really unique name, and what is the purpose, all right? So Dr. Johann de la Paz is our guest for tonight. He is physical therapist, Master of Science, and also Doctor of Physical Therapy, graduated this year in University of Montana. Congratulations, Dr. Johan. So without further ado, we will learn more about him and his PT Meal podcast and other projects. All right. Welcome to Fishy Jen. How are you, Dr. Johan?
Hi, Doc Jenny, and thank you for inviting me here. Yeah,
Yes.
finally.
Yes, yes. So it's my pleasure. So how and this is really unique, I would like to know more about what is PT Meal podcast and where's the name coming from? It's really unique.
PT meal started. The idea of PT meal started when I was in home health, and I was driving around going to my patients, and I always listen to podcasts. One of the podcasts that I listen to is PT Pinecast, and I hear
Mhm.
about different topics on physical therapy, and hear about expertise and experiences of other physical therapists here in the US and some abroad. And when I started to listen to that and more got into it, I thought of like um, there are a lot of Filipino physical therapists out there that are doing the same thing and that are excelling in their craft, in their specialties. And I thought of since I'm I've been hearing those physical therapists in that podcast, and that inspired me. So what more if I listen to someone who kind of came from where I came from, like from the Philippines, went to a different country and became a clinician, became a professor, or became you know whatever. So that's where the idea of PT meal came from, and at first I wasn't sure if that would click or if I have the energy to continue with that, because at that time it was just really a plan. But um come when the pandemic hit and everyone was like, okay, staying at home, or uh many are working from home, students you know are not going to their school, I thought of probably this is the right time to do it. And before that happened, I was in the Philippines um, around January before the lockdown came in, and I already spoke with my friends there and some of my professors there and told them that, oh, I'm going to start a podcast. I'm going to invite you. I'm going to invite you. I'm going to invite you. So since I already told that to a lot of people, I thought to myself, okay, since I've already said that to a lot of people, I don't have any choice but to continue with it. So that's when PT Meal was born. So I already thought about the name PT Meal um, like months ahead. So I thought of what are the words or verbs or ideas that we use in physical therapy that I can put as an acronym and create a word. So
Mhm.
I came up with PT Meal. So PT Meal is actually an acronym. So
Wow.
P means play,
Okay.
T means therapy, M means movement, E, it means exercise.
Mhm.
A means activities, and L is leisure. So those are the words that we use for our interventions in all the aspects of our treatment. Like if we handle pediatrics, we tell them, okay, let's play. Or if we handle geriatrics, which they are very allergic to the word of exercise, I would say, okay, let's try to move, let's do some activities, right? And for those who are like returning to their recreation and stuff, we use leisure. So I thought that could encompass the name of the podcast that I would create. So there, yeah.
Mm. That's really good. I didn't know that. So I thought that it's like a PT meal is just comprised of very nice topic, different. It's a complete combo meal to
Right.
discuss, right? Yeah, because I remember
Yeah.
that you say it's a combination complete meal. So I didn't know it's an acronym, and I agree with all those meanings. It in each,
Mhm.
it's all physical therapy. Yeah.
Right. And all the script that I came up with had to be incorporated with food because it's a meal. So, like what you said, yeah, it's a complete meal of information, of insights,
Yes.
and I just play around with it so that it's like a buffet, a potluck, or something like that. So it's all of the script. It's part of the branding, I guess.
Yes, I remember that when you say it's a combo of like that. And then I really remember, and congratulations, you're turning 3 years and you have more than 100 plus episodes in the podcast. And then these are, of course, with some challenges. And can you tell us some of your wins, your favorite moment or topic that you really feel that you cannot forget because it really hits lots of people,
Mhm.
of all those topics, what is the one episode that you remember that it's become controversial because many comments, many people are really motivated or something like that?
Mm. Actually, I like all my episodes. Of course, it's hard to pick one,
Mm.
because each and every one that I invite in my show, like you, Doc Jenny,
Mhm.
I know that you guys can share something to the audience,
Yes.
and those specific topics are in line with your specialty, so that you have a lot, rich experience, as well as the years that you spend in that specialty. It created your what wisdom and expertise. But I guess if I had to choose one, which is, I guess it touched a lot of um, uh, the hearts of the audience, especially a professor in one of the schools in the Philippines,
Mhm.
is the episode about community-based rehabilitation. It
Yeah.
was, I guess, it was impactful that much because that professor included that interview in their curriculum.
Mhm.
So every year I would see a spike in my um, analytics on that episode because the students are given the chance to listen to it. So
Cool.
it was moving as well because what the guest talked about, it was Sheen Sinyadoza. She's the head of the physical therapy department in the community-based rehab in Rizal, Philippines. So she talked about um, touching the hearts of indigent patients, and whenever she goes out to the community, the her patients, the relatives of her patients would say hi to her and tell her that, oh, you helped me move again, you helped me go back to my work, you helped me walk again, be with my family. So it was really touching, to the point that my guest, Mom Sheen, was somewhat crying already, because it was really moving. She was moved by the reception of her patients to her, as well as the lives that she touched. Because in the community, well, in the Philippines, we don't have physical therapist assistants, right? And in the community,
Mhm.
there's a lot of lacking physical therapists. So we have community-based rehab workers, CBR workers, that
Mhm.
acts like an extension of the physical therapist. So the physical therapists train these workers to somewhat handle some treatment that can be passed on while she's in the room. So even that, it she would tell she told in the episode that um the CBR workers' lives changed because of that, and it some of them are being interviewed as well, and they credit their learnings from her training. So it was really touching as well as moving, and it shows that you don't have to earn a lot to have that sense of fulfillment in our profession, and that's also what really stuck with me when I remember her episode.
Yeah, I really think
Mhm.
that that's one of the best. And the fact that Professor Sheen shares that to the future therapists or more other younger students, it will really give more impact because it will deliver more. And that's the goal of the podcast, to give more information, motivate, inspire, right?
Right.
So you hit that goal right there in just one episode. That's really a good choice. You really hit that. Thank you so much. And that's really kudos because in each episode we learn something, we touch something, and then we already highlight also different entrepreneurs or physical therapists doing great in their field. But like us, we are geriatrics, you're a geriatric clinical specialist, but why physical therapy and of all different specialties, why geriatrics, Johan?
Mhm. Oh, actually, I wasn't sure what program I was going to take when I was in high school, and physical therapy was a suggestion by my sister. She's a nurse, so she was studying as a nurse before, and I was getting into college, and she said, okay, why not try physical therapy? That because that was her second choice. And at
Mhm.
that time, she said, "Oh, physical therapy is like being a doctor without being a doctor." And at that time in the Philippines, it's not that way, right? We all know
Yeah.
that we're not doctors in the Philippines. So,
Yes.
but as I go to the program and had my major courses, I learned to understand and appreciate physical therapy at that time, especially when it came to our internship, the last year of studying, that I was able to really practice what I learned, and especially in the clinical rotation where we were semi independent in the community, because right after doctors or clerks, med students see the patients, they would immediately refer them to us, and we weren't supervised by anyone back then. We would, if there's any problem, we would contact our clinical supervisor in Manila, but we're in the province. So we're like acting as, as the chief physical therapists back then. So
Mm-hmm. Yeah.
I, I that's when, I kind of get the sense that being a physical therapist is important to one's life, especially after injuries, after any health event, and especially in health promotion as well, because we had like
Yes.
some talks there for our community as well. So I kind of that's when all things came to, okay, I'm gonna do this. I'm gonna be a physical therapist. So geriatrics came to me. I didn't choose it. I thought I'll be going to orthopedics
Mm-hmm.
or ano, or
Manual.
neuro or manual. But when I came here in the US, my first work was in home health, and I enjoyed home health. I enjoyed working with the people that I go to. It's mostly geriatrics, so dementia, deconditioning, post hospitalization, uh, um, uh, arthroplasties, and I learned that my demeanor really fit the geriatric population, um, because I'm more, I don't know, patient, calm. I like to soothe, my patients. If they're not, participative, I try to find a way to appease them, make, light the situation, like playing some music and stuff like that. So, even though I feel that being in geriatrics, it's such an underrated specialty that people will say, oh, that's all, it's like old age and stuff. But you have to be creative when you're dealing with the older population, especially with people with dementia and other conditions. So it was challenging at the same time. The fulfillment is there because you see the patients, being happy, and the simple joy of just standing up, being able to walk, being able to balance themselves, being able to walk to their mailbox 10 feet away. So that's fulfillment, pure fulfillment, that I have experienced. So that's why I like geriatrics.
Yes, yes. Great choice. And that geriatrics also is the combination of everything. In geriatrics, you have arthroplasty. That's orthopedics, you know.
Yeah.
Geriatrics,
Hmm.
you have a neuro because you had the strokes. That's
Hmm.
typically combination of everything.
Right.
And your personality is fun. And then we're so chatty, as you said, you're patient because they love to talk and we need to listen,
Hmm.
and that's
Right.
the sometimes there is a specific like personality that hits a specific specialty too. So kudos to
Hmm.
you. And also it's a passion what we're doing. If you're enjoying what you're doing, you're in the right
Hmm.
specialty, right? So that's
Right.
really good. Yeah, I remember Dr. One of our the person we interviewed in manual therapy, you interviewed him as well. I interviewed him in eclectic approach.
Oh, Dr.
He,
E.
yeah, Dr. Erson Relioso. And then he said, oh, anybody who has a bone, that's orthopedic. So even you're
Exactly.
in geriatrics, you're an orthopedic. You don't say that you're not doing manual. You're doing total hip, total knee, you
Hmm.
know? So
Hmm.
it's always like interrelated to each other. So that's really wonderful. Thank you for sharing also the geriatrics. So it's from your sister, from me, my classmate. I just copy her dream. She's at elementary. I don't know. You said,
Ah.
okay, write in a piece of paper. What's your dream course like that? She put physical and then there's a space therapy. So I read it, physical the rapist. I don't know, elementary. It's and then what's your course? And then she said, oh, that's my aunt in America. And then that's how I
Oh,
learned physical therapy. So I did that when I was high school, college. I learned, oh, that's physical therapist.
just
So that's
copying.
yeah, yeah. What's your dream? What's your course? I don't know yet that I just know I will be a doctor or something like that. So
Hmm.
that's really good. Congratulations in being one of our great podcasts. And what will be your tips, Dr. Johan, for our clinicians or Filipino physical therapists, anybody listening right now who wants to have a great podcast and successful podcast like you? How they can
Hmm.
begin, just simple things, or what
Hmm.
things they need to work out, challenges like that.
Hmm. I think the very first thing that they have to think about is who their audience is, or they said that think about your avatar. Your avatar is the one that you're gonna be targeting. So my target were Filipino physical therapists, anywhere in the Philippines or around the world,
Globally.
that are curious about the different specialties, different avenues, different settings that physical therapists can work to, or go into, or even non-clinical tracks or occupations that they can go to in case they are tired or burned out in the clinical setting. So um, also I thought of students, physical therapy students that are trying to think about what their future would be after graduation or after um, getting their license. Are they gonna be in the hospital? Are they gonna start their own company? or physical therapy clinic? Are they going to work in sports, or going to work in you know neurologic or orthopedic settings? So uh, those are the people that I think about. That is where the topics come in. So if I'm thinking about this type of person, what would they benefit from if I create a podcast? So if you have an avatar, or a person target audience that you have already in mind, then that your podcast aims would come along. So what is it for? Who is it for? And what are you planning to do with it? And and as soon as you get your avatar and your purpose, your aims, then it would be easy to come out with the first 10 episodes. What are the first 10 episodes that you want to produce? Who are the people that you know right away, at the top of your head, who can fill up those spots? So if you have that already, and you think about more, then for sure you have a running podcast, and you would be able to sustain that. But if you're having a hard time doing 10 episodes already in your head, then probably it's not the right topic for you. You must think of a different avatar, or think of a different aim for your podcast, or whatever medium you're gonna go into. So it's easy, because there's a lot of programs nowadays that would um, let you upload your recording, and and they would be the one to distribute it in different apps. So I'm using Anchor, and once I upload it, I upload my recording there. Anchor is the one that distributes it to Spotify, Google, Apple, iHeartRadio, and many more. I forgot the other ones, so you just leave it there, upload it, and the rest is up to Anchor. So that's it. I think it's the main thing that you have to think about is, who are you making the podcast for, or who are you making the blog for, or the video for? So think of that, and then the rest would follow.
Yes, yes, that's right. So the skill will be, we can practice with the skill, but as long you have a niche, like you have an idea, you have a
Mm-hmm.
goal, I think that will play. And always look for a mentor, guys. Like Dr. Johan is already doing like 100 plus episodes. He is on his third year. If you have any question, definitely you can chat with him. And then
Mm-hmm.
because he's sharing this now, he has experienced what works out and what didn't work, what are expensive, because this has needs some resources too, so
Right.
what's the best podcast that you learned a lot, that you really like, and you're inspired, that
Mm-hmm.
you think of?
Mm-hmm. Um, well, of course, the one I have in mind was PT Pinecast by Jimmy McKay.
Oh yeah.
So that's where I thought of, like, okay, I can do it, but in a different niche, my Filipino peeps news. So
Mhm.
and then the other one was um School of Greatness by Lewis House. I like that podcast because he talks to different types of people from different backgrounds and different industry, and I like how he asks different questions that triggers an interesting answer from his guests.
Yes.
So those two podcasts are what I listen to every now and then, just to refresh myself on how to communicate, how to ask, how to approach a certain topic. If it's taboo, how do you handle that? So it's right. You want to emulate people who are doing it properly and for a long time. So those are the people that I try to emulate and try to be inspired by their skills in podcasting or communicating.
Yes, I'll do a shout out for you if I meet Jimmy. You're like you like his, yeah, PT Pinecast. Jimmy is a physical therapist, nice voice. He was also in the audio before. Like, that's really good. Jimmy McKay. Yes, so
Right.
that is more on some of the resources, great inspiration. How about any reading materials or books? It can be podcasts or related to physical therapy that you can share for our listeners or young PTs that
Mhm.
affects you a lot, inspires you,
Um,
motivational, like that.
uh, in terms of podcasting, I just there's a lot of resources in YouTube. I can't remember which ones I listened to. I think one was Pat Flynn. I think he's also a podcaster. He's a motivational speaker and a vlogger, a YouTuber. So I think that's one. And but there's a lot of videos and resources in podcasting out there. You can read blogs and watch videos. And there are podcasts as well that teach how to podcast.
Mm.
So there. In terms of physical therapy books that have impacted me, I guess right now what I'm reading is primary care for physical therapists because where I'm working at, I'm the only physical therapist in that hospital, and mostly I get referrals with just the diagnosis or the complaint, like low back pain and stuff like that. So I feel that it's a challenge for me because for the past, past uh, work that I have, I'm in the comfort of accessing the doctors right away. Like in SNF or in home health, I have already all the discharge papers. In SNF, I can ask the doctors right away. They're there. But right now, where I'm practicing, I feel that it challenges me more to really pinpoint what the patient's complaints are, if it's appropriate for physical therapy, if they're appropriate to be referred out. So that's what I'm reading right now.
That's really nice. Yeah, you really make a leveling yourself, and education is always a learning process is continuous, it's
It's true.
endless. That's really good.
Mm,
That's really good. And then it's really tough because you're the primary care, just the title itself. You need to learn more because they depend on you.
mm,
So that's really good too. Yeah. How
yeah.
about our listeners, clients, or caregivers for the Balance and Fall Support Group? As a physical therapist, what's your best or favorite exercise to improve balance, decreasing falls? Especially, we just had the Falls Prevention Awareness Month
Mm,
recently.
mm. Well, I usually my go-to balance exercises, which I feel really challenges the patients as well as let them experience instability, and I appreciate the systems that go in with balance is the ones that you ask them to stand with their um feet wide, then feet narrow, then
Oh, yeah.
feet wide, eyes open, eyes closed, feet narrow, eyes closed, eyes open. Then after that, you just get to play with them. Uh, you have them narrow their base, then ask them to move their head side to side, ask them to, move their hands side to side, different directions. So playing with the base of support is and the vision is one of the my favorite tasks for balance for my patients and my clients, and they appreciate it because once their vision is occluded, they have to rely on their other system, the vestibular system and their somatosensory system, and that gets them, and they were like, there you would see the aha moment in them. And once you start with the other perturbations, they
Yes.
would really appreciate, oh, this is hard, this is hard, this is hard. Then once they are able to do it, they appreciate, oh, I'm getting better because I'm able to do it now, I'm able to do it now. So yeah, so that's my best basic exercise for balance for my patients.
Yeah, it's very simple, right? Very simple,
Hmm.
easy to explain. Let's say, okay, one leg stands. Let's try to challenge it. One leg stands, eyes closed, then you then you nudge
Yeah,
them.
right, right.
No, no,
Yeah.
that's too advanced.
They're gonna be
And
surprised, like, why are you pushing me? Like,
okay, that's perturbation. That's
uh,
really, really easy and but challenging. One leg
mhm.
stance itself is from Sakamoto is one of the best simple exercise just to improve balance. That's really good. And then last but not the least, what keeps you moving? Inspiration or exercise?
What keeps me moving is the idea of being able to just hang out in nature. So um, being able to watch the sunset. It sounds cheesy, so watch the sunset because I'm near the coastal California. So I would just have to drive like 20 minutes and at the beach already. So and we have a lot of hills and we're kind of near some mountains here. So those are the things that I look forward to during the weekend that would keep me moving and active somehow.
Yes, yes. Thank you so much. Tell us more how we can connect with you and your YouTube, your Facebook, and this is a really great opportunity to learn more about you and your projects.
So thank you very much, Doc Jenny, again for this opportunity to talk with you and your audience here. They can reach me through my website. It's ptmealpodcast.com. Uh, the podcasts are all the podcast episodes are there. Um, Most of them are in Filipino, but some of them are in English. I am still trying to find the energy to put some captions on it so that it's more related, other people can understand them. But hopefully uh when the time comes that I can have someone to help me, I can put captions on it. And I know because our experiences is fairly relatable and alike, so that other people can um benefit from that show. You can also reach me in my social media in Facebook, Twitter, LinkedIn, and Instagram, all PT Meal Podcast. There. So yeah, you can reach me there. And again, thank you, Doc Jenny, for this opportunity to speak with you.
You are very welcome. Congratulations again, Dr. Johann. Thank you for inspiring all of us. Your work, your episodes are really motivational, and we always learn a lot from everybody. And thank you and congratulations to all those being featured. You're all awesome. So thank you once again, Dr. Johann. Guys who are listening right now, Philippines, abroad, globally. Salam alaikum. If you're in United Arab Emirates, he's been featured as well. People in Saudi Arabia are physical therapists, UAE. So thank you so much for listening and thank you, Dr. Johan. All right. So if you have any questions, guys, we will post his emails, his any link, and you can chat with him. All right. Bye for now, guys. Thank you, Dr. Johan. Bye bye.